Hello, welcome to my head-to-toe physical assessment, Nova Sit. Since Sadie was my vital signs demonstration, I will be using Nova today. Hi Sadie, Nova, sit, yes. So just as with anything, we would start by introducing ourselves to our client. Nova, hi, my name's Natalie. I'm a nursing student. I'm going to be doing a physical assessment on you, assuming that the patient is new to, we'll just pretend and say that Nova has admitted herself to the ER, presented to the ER, and we're going to be doing an assessment to see exactly what it is that she is here for today. Hi, Nova, sit. Yes, wait. So, hi Nova, my name is Natalie. I'm going to be doing your physical assessment today. Rude. Hey, puppy, sit. Thank you. I'm going to verify that I have the right person. Nova. Yes. So she makes eye contact when I call her. I'm going to use that as verification. However, normally we would use two-factor verification by having the patient state their name and birthday, or some way that we can in two ways verify, yes, you're sitting in my lap, two ways verify that we do in fact have the right person. If they had an armband, we could compare what they tell us to what's on the armband, things of that nature. So I have verified that I have the right client. I would like to start out just a general impression type data collection. Nova, sit. Nova, do you have any complaints today? What brings you into the ER? And just kind of get a story. While they're talking, I am looking at, just like I said, my general impression of what's going on. Their speech patterns, their level of interactivity, levels of eye contact, how they are communicating, noting any kind of abnormalities. Are they guarding anywhere on their body? Hi. In this case, Nova is very friendly, very playful. She is moving around a lot. She is responding and interacting with me appropriately. They also happen to know that I have treats in my pocket in case bribery is required to keep their attention throughout this entire video. So excuse them if they're being a little extra nosy and kind of rude. But as I said, I am just generally observing Nova. She has normal gait, normal posture, normal responses. Good girl. Nova, down. Yes. Now, as typically we would be doing this from head to toe. Because she's following commands right now, I'm going to use that as my AVPU assessment. She is alert and oriented and responding accordingly. I can't ask her things like her name, where she is right now, what date it is, and things of that nature, which would normally establish that alert and oriented. However, given that she is a dog, she responds to her name. Nova. Yes. Yes, she maintains good eye contact. She follows commands. Nova, sit. Yes. Down. Yes, good girl. So I will use that and say that Nova is in fact fully alert and oriented. I could even go so far as to say that for the most part, I am seeing most cranial nerve function is intact and normal. Hi, baby girl. So starting with her head, Nova, up. Yes, sit. I am going to inspect the head and face. She has fur all over her head and face. She's also quite squirrely and seeking scritchies. Now I take this to mean that she is seeking attention, not that she is seeking actual scritchies because she is itchy for some skin reason, if she had a rash or something of that nature. But as I poke, prod, and feel, I am not noting any signs of pain, just the typical very squirrely Aussie. While we're up here, I would be looking for things like scars, wounds, deformities, things that are not quite as they seem. I could go in here at this point with a pen light and check pupils as well, start to do some of the eyes, ears, nose, throat assessment throughout the head. Now, I have limited equipment here. I don't have a pen light right now. Also, I happen to know from experience, Nova does not like me poking and prodding in her ears. She had to have ear medicine one time. Nova, come here. Sit. So she is paranoid about me poking around her ears too much, but I can at least do a bare bones inspection. I note that the flesh inside her ears is pale, but that is normal for her. We don't want a lot of pinky redness. I can check her, it's the dog's variation of capillary refill on that skin tissue. When you get down where the hair is no more, you can give it a little pinch. Wait, come here. I know you hate me fussing with your ears. Okay, she's gonna run away from me. Come here, Nova. Come here. Sit. Uh-oh, they're both gonna sit. That's Sadie, by the way. I can do a double assessment. There you go. Those are good doggies. Sadie is in the same vein. Sadie actually lets me manipulate her ears pretty well. I can look way down deep in Sadie's ears and note that there is no redness, there is no cerumen, no earwax. she's prone to ear infection, Sadie is, so there's no signs of infection. She gets that black, tarry, goopy stuff in there when she has an infection. Hi, Nova. You're the one I was looking for. Nova's ears are not hot to the touch. She's mad at me. She doesn't want me playing with her ears. Sit. Thank you. Looking at her eyes right now as she sits here facing me, she has reactive pupils, things that I can't actually see that with the light that we have in here. She does have reactive pupils. Her face is symmetrical. Her nose is in line and intact. Nova, sit. I can attempt to look up her nose. Good luck with an Australian Shepherd. She is quite nosy. Sadie, will you let me look up your nose? Oh yes, thank you. Sadie's nose is a little bit moist. She just had a treat and I watched her lick her nose. So you also do want dogs' noses to be moist. Now, if a human nose was moist, the assumption would be that they were maybe a little congested, and that might be from some snot or nasal discharge. We would want to make sure that the septum is intact. There's no perforations, lacerations, redness, or discolorations up in there. And while Nova's mouth is parted and panting, I am looking inside her mouth. I see some very nice teeth. Nova has one funny chip tooth from when she was a puppy. She ran headlong into our screen door, and she chipped that little tooth right there in the center. But I know her history. I know about that. Looking, I see a nice pink tongue, nice pink gums. Hi, Sadie. Can I see your mouth too? Sadie lets me take a peek. Sadie has really healthy teeth, only the slightest yellowing discoloration around the teeth where they meet her gums. But Sadie has had gingivitis before, so we have to brush Sadie's teeth regularly. I'm sorry, I'm kind of flipping back and forth between the two of them. One dog is a little bit more mellow but refuses to do anything but lay and receive belly rubs, and the other dog is kind of a spaz. You can guess which one's which, so we will make do here. Moving from the head, I'm gonna look around the neck. Hi, Nova, are you just mad at me now? You don't want me messing with you? I'm sorry, I didn't mean to play with your ears. I'm gonna feel around her neck. I'm gonna feel the top of her C-spine here a little bit. I can feel her vertebrae as I go along. Oh, she likes that. And I feel no step-offs, no bulging discs. I am not eliciting any pain responses. In fact, I'm getting a very sleepy puppy. I think I just learned a new trick here. Give Nova a neck massage and she chills out. I don't feel any muscular deficiencies either, like unequal muscle mass on either side, no lumps, no bumps, no deformities. And again, she is covered in fur, so I have to go digging a fair bit. I did find her collar buried amongst the fur. There is a collar in here, but nothing on the neck. If I can get Nova, sit, to look up for me, I can take a peek on the front of her. And again, I have to dig through a fair amount of fur. I'm gonna work my way down to her chest while I'm doing this because I am conveniently in a very nice position. Hi. So I am inspecting the chest, and if this were a human, would be a prime opportunity to visualize equal bilateral chest rise and fall. Now on Nova, I'm kind of jumping around. If we move back up to Nova's neck, I'm feeling along the sides, and if she holds still, I should be able to feel, no, she's gonna get mad at me here in a second. If I needed to, I could feel carotid pulses on her. Oh, it's just the good scritchies. She likes these scritchies. But I can feel her trachea. I can make sure that everything is straight and in line along the trachea. I will not be able to visualize things like jugular vein distension on Nova, not even on Sadie. That fur gets in the way. It would have to be very significant, even on Sadie with her thinner, finer fur. So Nova's not going to be demonstrating anything like that today. Nova, sit. Thank you. May I have a paw? Oh, yes, thank you. Oh, good girl. So like I said, we're working our way down the chest. Now, Sadie is conveniently laying down here on the floor, and I can see Sadie's chest rise very nicely. For a dog like Nova, she's very excited. She's panting, so her respirations are going to be outside of my normal human reference range. For Nova, however, this is going to be very, very normal. So as Nova loves this physical contact, it's going to be very easy for me to just kind of wrap my hands around her rib cage and palpate the expansion of her chest and ribs as she pants. Yes, that's a good girl. Yes, you're panting, and it's not even regular rhythm panting. Oh, now everybody's on the floor. Okay, we have floor dogs now. Nova, yes, no, okay, all the way up. Yes, thank you. Well, this is actually a very convenient position. From the chest, I will move down to the abdomen. Now, generally, we are going to look, then listen, then feel. Hi, Nova. So I can visualize. Sadie's actually a better example of this right now because Sadie is all the way on the floor. So if I relocate this, oh my gosh, this is going to be a mess. This might not work. If I relocate this to Sadie, let's see if I can get, Nova, get out of the way. Nope, that's not going to work. We're going to try this again. So with Sadie laying down on the floor, I can visualize the abdomen. Again, asking before I start poking around, I'm going to feel around the abdomen, ask the patient to let me know, is there any pain anywhere as I go? Please let me know before I get there. If there was a painful place, we would palpate that last. And that is after we inspect, even after we auscultate to make sure that there is not something physically wrong, why we should not be touching, in which case we would need to let the provider know and take further considerations from there. So while we were feeling the chest, these are dogs, so it's easy for me to forget some of the stuff that I might check that I would otherwise check on a human. Obviously, we were checking for skin being intact, any deformities. Bodies like to be symmetrical, so making sure that everything is the same on both sides. We can check, I mentioned equal bilateral chest rise. We could also auscultate lung sounds as we go throughout all of this. Same thing when we come down to the abdomen. We have the four quadrants of the abdomen, upper, upper, lower, lower. We can inspect first, make sure that there are no blaring masses, obvious deformities, any discolorations, bruises, lacerations, anything of that nature. Now, Nova can't tell me if she has any complaints, so I'm going to go with she has no obvious anything going on as far as what I would see or what I would feel. We're not going to have belly pain. Nova ate a good dinner last night and she's been nomming on treats. For dogs, those are all good signs. She wants water, but not excessive amounts of water. I witnessed a bowel movement earlier this morning and all appeared normal. So we're gonna go with Nova does not have any abdominal problems, but these are all things that we can take into consideration even as a human. Asking them about recent diet, their last meal, recent bowel movements, if they have had any changes or differences, any pain, anything of that nature, which starts to go into genital urinary systems as well. But in Sadie's case, I can feel around her belly and all she wants is more belly rubs. She is very happy with me poking around her belly. So for Sadie's sake, she's on the floor. I can move around and start to feel her hips. Sadie actually does have one hip that's a little bit weaker than the other. Right now, it's the one that's on the floor. So I'm not able to feel it with the current position, and she doesn't like it when I overly manipulate her. But feeling her right hip, she has a wonderful hip joint. She does let me manipulate it and move it around to a certain extent. Say hi, Sadie. And it doesn't bother her at all as I do that. Now, with Nova, because Nova's very mobile right now, she likes to be a dog on the move. I didn't see any changes in her gait, so following the abdomen as we work our way down the body. In Nova's case, come here, baby. Come here. Yes. Nova has real nice hips. She's a very young dog. She's not even 2 years old yet. So I can pick her up and fully manipulate her, and we have no joint problems. Hi! In this case, I can use passive range of motion to do the manipulation of her joints for her. If this were a human, I only have so many commands that these dogs know. We don't even have shakedown yet. But I could ask a client either while they were still laying in bed or if they felt more comfortable, asking them to stand up and start moving their body around on command, showing me range of motion, getting pulse motor sensory as we go. As we check the arms with the upper body, making sure that we have equal pulses, and then double checking to make sure that we don't have any pulse deficits. So listening to the apical pulse while somebody else simultaneously feels either a radial or some other peripheral pulse, and then matching them. They should match. If there is a mismatch, then we would have a deficit. We'd have to determine how much of a deficit, and that's something worth noting and passing along to the provider. In Nova's case, she's a very healthy puppy. She doesn't have stuff like that. Hi, Bubba girl. But that's one of the things we could check. As we move down to the lower legs, again, checking range of motion, no deformities. I know coming from the emergency medicine side of the house, we always use the acronym DCAP BTLS. It kind of is just the catch-all of anything out of the ordinary. Since I checked cap refill on her ears, she's covered in fur, so I can't really check paws for things like capillary refill, but we could check her paws, in this case her front paws if they were her arms, oh we're going back to the floor again, or her back feet paws for legs. Nova lets me fully manipulate everything. She demonstrates no problems in range of motion. Yes, hi baby girl, she's just really cute too. I'm also finding that doing Doing these assessments on the dogs is really, really distracting because they're just so stinking cute and they don't manipulate very easily for some of this stuff. As you were seeing, Nova tends to just kind of end up a flopped over puddle on the floor, and Sadie started a flopped over puddle on the floor, and it doesn't really get much better than that. So if I'm forgetting a lot of stuff along the way, it's difficult when I don't have a human reference. Vitals could be incorporated into your physical assessment as you do your head to toe, especially once you've confirmed like your pulse motor sensory that there is no obstruction or reason why we couldn't take vitals in certain places, like a blood pressure on an injured arm, things of that nature. That'd be a good one to incorporate into a head to toe physical assessment. Hi, baby girl. Vitals would also tell us a lot of other pertinent information, but other physical assessment tools could be things like checking visual abilities with a Snellen chart, things of that nature. When we check ears in the tympanic membrane, we're looking for kind of that milky white. We don't want redness. We don't want excessive cerumen buildup. Hi, baby. Yes, you're a very good Dougie. And then we go in the order of look, then listen, then feel. So that we look and make sure there isn't a problem, as we listen, confirming no problems, before we start poking around and feeling and potentially exacerbating pain or some underlying issue that we hadn't already identified. And with that, I'm going to call it quits and go ahead and upload this one for the day. Thanks so much for watching.